different muscle groups. If you remember, the first group of muscles that we've discussed was the muscles of the head and neck, the ones first that are going to be responsible for facial expression. If you remember, those include the epicranius. And if you remember, the epicranius was formed of two muscles, one in the anterior aspect of the head and one in the posterior aspect of the head, connected by the sheet-like tendon or aponeurosis. We call this is mygale aponeurotic. If you remember the anterior muscle here in the front of the head, this is my frontalis, and the posterior part on here, it's my occipitalis muscle. Remember, the frontalis muscle is going to be responsible to raise your eyebrows, to wrinkle the skin of your forehead. Circular muscles we've seen around the eye, it's my orbicularis oculi. Orbicularis oculi, if you remember, orbicularis oculi action was to allow blinking and to close the eye. Another circular muscles that we've seen around the opening of the mouth. If you remember, this was the orbicularis oris, and another name that we've given for it is the kissing muscle. Remember, it's responsible to purse your lips and to close the oral orifice, the opening of the oral cavity on here. We've seen a muscle that gets its origin, if you remember, from my zygomatic bone and will be inserted in the angle of the mouth. We call this is my zygomatic thing. If you remember, we've got two of them. We've got a large one. This is my zygomaticus major, and the smaller one on here, this is my zygomaticus minor. And we called this muscle is a smiling muscle. If you remember, because when I contract, I'm putting the angle of the mouth upwards, so this allows smiling. We've seen another muscle that was located in the side of the cheek. This is my buccinator muscle or buccinator muscle. And remember, the buccinator muscle was responsible to increase and decrease the pressure within the oral cavity, allowing whistling, allowing the suckling, and also is going to be compressing the food while you're chewing from being accumulated in your cheeks. A major mastication muscle is the masseter. If you remember, the masseter gets its origin also from the zygomatic bone and zygomatic process to be inserted down in the angle of the mandible. Remember, the masseter is responsible to allow the elevation of the mandible, and it serves as a mastication muscle. Seen another muscle, it's a thin muscle that gets its origin from the sternum and the clavicle and will be inserted in the lower margin of the mandible. We call this as my platysma. And if you remember, the platysma was responsible to stretch the skin of the neck. It's also responsible for the facial expression for horror and fright. And it plays a minor role in terms of depression of the mandible. See another muscle that gets its origin from the sternum, from the manubrium sterni, from the medial 1/3 of the clavicle, and gets inserted in the mastoid process. We call this as my sternocleidomastoid. And the sternocleidomastoid, if you remember, its action was to allow the rotation of the head. If you're contracting one side at a time, you're going to be rotating the head from side to side. If you contract both sides in the same time, this will allow neck flexion. We've seen another group of muscles that will be allowing the movement of the arm, the first muscles that we've seen was the pectoralis major. And if you remember, the pectoralis major gets its origin from the clavicle, sternum, and the costal cartilages, and gets inserted in the anterior aspect of the humerus. If you remember, the pectoralis major was responsible to allow flexion of the arm as well as adduction of the arm. And antagonist muscles that we've seen in the back, this was the latissimus dorsi. Remember, the latissimus dorsi gets its origin from the spine, lower thoracic and lumbar sacrum, and as well as the iliac bone. And its muscle fibers will be traveling to be inserted in the anterior aspect of the humerus. So it's going to be pulling the arm backward, allowing the extension of the arm. So it antagonizes here the pectoralis major. So the prime mover for arm flexion, it's the pectoralis major, compared to the prime mover of the arm extension is the latissimus dorsi. Another muscle that also gonna be allowing the movement of the arm was a triangle shaped muscle of the shoulder that gets its origin from the lateral 1/3 of the clavicle as well as the acromion and the spine of the scapula. And this muscle here gets inserted down in the midshaft of in the lateral midshaft of the humerus to the deltoid tuberosity. We call this muscle is my deltoid. So getting its origin from the clavicle and the scapula and inserted down here in the lateral aspect of the shaft of the humerus, when it contracts, is going to be pulling the arm away from the body. We call this movement is the abduction of the arm. So the prime mover for abduction of the arm is going to be deltoid. Deltoid. We've seen a muscle that will be getting its origin from the external occipital protuberance, external occipital crest, the spinous processes from the cervical vertebrae and the thoracic vertebrae. And its fibers will be inserted in the spine of the scapula. We call this is my trapezius. If you remember, the action of the trapezius is gonna vary according to which fibers am I contracting. If I'm contracting the upper muscle fibers of the trapezius, this will allow you to pull the scapula upwards. And this movement is what we call the elevation of the shoulders. So if I contract the upper muscle fibers on here, this is gonna result in elevation of the shoulder. If I'm contracting the middle muscle fibers, I will be pulling the scapula towards my spine. We call this is the retraction of the scapula. If I'm contracting the lower muscle fibers, you see on here, the lower muscle fibers are traveling up to be inserted in the superior surface of the spine of the scapula. So when I contract, I'm pulling the superior surface of the spine of the scapula downward. This is going to result in a rotational movement of the scapula, allowing the rotation here of the scapula to take place. If I fix the scapula is not moving, and I contracted the upper muscle fibers of the trapezius. So instead of moving the scapula, I will be pulling on the external occipital protuberance. So the trapezius, if you fix the scapula, you don't allow the scapula to move, and you are pulling on the origin, to be more specific, the origin from the head. This is going to allow neck extension. So trapezius here, it's going to be opposing the sternocleidomastoid in terms of neck flexion and neck extension. So sternocleidomastoid, if I contract both at the same time, this will allow neck flexion. trapezius, it's gonna be allowing neck extension. We've seen a group of muscles that will serve as reinforcement for my shoulder joint. Remember, those are my rotator cuff muscles. If you remember, we've seen a muscle that gets its origin from above the spine of the scapula. We call this is my supraspinatus. We've seen a muscle that gets its origin from the fossa below the spine of the scapula. We call this is my infraspinatus. And we've seen two cylindrical shaped muscles. One is small, one is larger in size. So we call the small one, it's my teres minor, and the large one, it's my teres major. On the other side of the scapula, if you remember, we've seen a muscle that gets its origin here from the inferior surface of the scapula to be inserted in the greater tubercle of the humerus. So you see on here, this is my muscles that get its origin from below the scapula, because remember, the anterior surface of the scapula is also inferior because the scapula, it's not erected, it's not at 90 degrees. It's inclined forward. So its anterior surface is also going to be inferior. So the muscle here gets its origin from below the scapula. So we call this muscle is my subscapularis muscle. Subscapularis muscle. We've seen two muscles that will allow the movement of the forearm. One of them is located in the anterior aspect. This was my biceps brachii. Remember, the biceps brachii has two heads, a long head and a short head. Long head gets its origin from the glenoid cavity of the scapula, compared to the short head, it gets its origin from the coracoid process of the scapula. The two heads will meet together in the anterior aspect of the arm and will form a single tendon by which they will get attached or inserted in the radial tuberosity of the radius. What is the action of the biceps brachii? It is the prime mover for forearm flexion. The prime mover for forearm flexion is the biceps brachii. We see a muscle in the back of the arm that has three heads. We call this is my triceps brachii. Remember, the triceps brachii has a long head, a lateral head, and deeper to it, it's gonna be my medial head. Long head. This is my long head on here. This is my lateral head, and deeper to the lateral head, we've got the medial head. This is my triceps brachii. Long head gets its origin from the scapula, compared to the medial and lateral heads will get their origin from the shaft of the humerus. See the three heads on here forming the main bulk of the muscle will join together and will be inserted in the olecranon process of the ulna by a single tendon. So they all share the same tendon to be inserted in the olecranon process. If you remember the action of the triceps brachii, it was to perform extension of the forearm. So I'm the prime mover for forearm extension at the elbow joint. We've seen few muscles in the anterior aspect of the forearm that will be performing a movement of the hand or the fingers. If you remember, the first muscle that you've seen was located in the anterior aspect of the forearm that has a single tendon, and this tendon is going towards my thumb. So remember, we call this muscle, it's my flexor carpi radialis. So 3 characteristics on here will tell me the name. I'm in the anterior aspects. This means that when I pull on the wrist joint, I will be performing flexion, so I will call it flexor. I have a single tendon, and I'm inserted in the wrist. So I'm performing the flexion only on the wrist joint. I'm not performing any movement to the fingers. So I'm not digitorum, I'm carpi. Remember carpal, carpal means related to the wrist. And I have a single tendon going towards the thumb. Remember, going towards the thumb means it's going to be inserted on the lateral side. So being inserted on the lateral side, it makes me related to the radius, which is the lateral bone of the forearms. That's why we call this muscle, it's my flexor carpi radialis. We've seen 3 extensors, a muscle in the back of the forearm that has 4 tendons going to be inserted in the fingers. And you see on here, this is my extensor digitor. Extensor digitor. I have a muscle with a single tendon, and this single tendon on here, this muscle on here has a single tendon, and its tendon is going to be inserted away from the thumb. So it's going to the medial side. Remember, medial bone of the forearm is my ulna. So this is going to be my extensor carpi ulnaris. We've seen a muscle with a single tendon that goes to be inserted in the same side as the thumb. So it's going to the lateral side. So we call this as extensor. I have a single tendon, carpi radialis. But those characteristics will be applied to actually 2 different muscles. So remember, we call this one on here, it's my extensor carpi radialis longus, because it's longer than this other one. So the other one, we call it the extensor carpi radialis brevis. So again, the 3 that we need to know for the upcoming lab exams, those are the extensor carpi ulnaris, extensor carpi radialis longus, and the extensor digitor. Those are the 3 muscles that we need to be able to identify from the diagrams and to know their actions. The last thing that we've been discussing last session, if you remember, was the muscle layers forming the abdominal wall. If you remember, the outermost, the most superficial muscle layer of the abdomen, it's formed by an oblique muscle. We call this is my external oblique. If we dissected the external oblique muscle, we're going to see underneath it another oblique muscle and a straight muscle. We call the oblique muscle that was located deeper to the external oblique, it's my internal oblique. And the straight muscle of the abdomen, we call this is my rectus abdominis. Rectus means straight, and abdominis related to the abdomen. If you notice on here, the 2 recti muscles are attached to one another by this tendon. We call this tendon, it's my linea alba. Linea, line, and alba, white. So the white line here, that would be traveling all the way from the xiphoid process all the way down to the pubic bone, it's my linea alba. It serves as the attachment between the right and left recti of the rectus abdominis. If we dissect the internal oblique as well as the rectus abdominis, we're going to see deeper to those a muscle which fibers are traveling in a horizontal pattern. We call this is my transversus abdominis. If you remember, external oblique was mainly responsible for the rotation of the spine. Rectus abdominis was mainly responsible for flexion of the spine. And into transversus abdominis was mainly responsible to compress the abdominal organs inside the abdominal cavity. So this is briefly what we have been discussing last session. Any questions? Any questions related to those previously covered muscles? All right, great. All right, so today we are starting a new set of muscles. First, the muscles that will be allowing the movement of the thigh. So if we're looking on here, we have a large muscle in the gluteal region. We call this muscle, it's my gluteus maximus. If we remove this muscle on here, we're going to see deeper to it. It's the gluteus medius. So gluteus maximus, this is going to be gluteus medius. So if we're looking here at the gluteus maximus, where do I get the origin from? If you see on here, I'm getting my origin from the iliac bone, from the sacrum, and I'm going all the way down to be inserted in this sheet-like tendon on here. So this is a tract or a band. And I will also be inserted, if you see on here, in the lateral aspect of the femur. Let me remove this one on here. This is my, again, gluteus maximus. So what do you think is the action here of a gluteus maximus? This is my point of origin. This is a point of origin for the muscle. And this is a point of insertion. So when I pull the insertion towards the origin, I am moving the thigh on here backwards. So what do we call this movement? What do we call this movement? The backward movement of the thigh. Remember, this is my hip joint. This is the angle of the joint. This is the angle of the joint. So when I pull the thigh backwards, like this, what happens to the angle of the joint? Will it increase or decrease? What do you think? So we're looking here. This is my gluteus maximus. This is the thigh, like this. Then use that I have my origin at this point, the gluteus maximus, and I have the insertion in here. So I'm trying to pull the insertion to move towards the origin. So this results in what movement? See on here, my thigh is going to be moving backwards. So this is the angle of the joint. This was the angle of the joint before I contract this muscle. And now this is the angle of the joint. All of this. So what happened to the angle of the joint after I contracted the muscle? Did it increase or decrease? The hip joint angle, did it increase or decrease? Increase. And if I have an increase in the angle of the joint along the sagittal plane, what did we call this movement? An increase in the angle. What do we call this movement? An increase in the angle of the joint along sagittal? It's extension. Extension, exactly. So again, what is the action of the gluteus maximus? It is a prime mover for thigh extension. So I am pulling the thigh backwards. And why do I need to extend my hip joint? Why do I need to extend my hip joint? To climb the stairs, to stand up. Without gluteus maximus, I won't be able to stand up. I won't be able to climb the stairs. I won't be able to walk. Right? So all the time we are using the gluteus maximus because we perform flexion and we reverse this flexion by performing extension of the hip joint all the time. All right, so again, what is the action of the gluteus maximus? What is the action of the gluteus maximus? It's to perform extension of the thigh at the hip joint. Extension of the thigh at the hip joint. Removing here the gluteus maximus, we're looking at the gluteus medius. You notice on here, this is my gluteus medius. I am getting my origin from the iliac bone. And I'm going down to be inserted in the greater trochanter of the femur. So this is going to be the point of insertion. So when I contract the gluteus medius, what's going to be the action on here? What do you think is the action? You're pulling this point towards this point. So the femur is going to be pulled outwards. I am moving the thigh away from the midline. What do we call this movement? What do we call this movement? Abduction of the thigh. Abduction of the thigh. So I have the femur, I'm putting on the femur, so the femur is going to be moving away from the midline. So when you pull on here, so imagine this is my femur. Not sure if you can see here. Right, so imagine this is the femur, and I'm pulling the femur from the outer point, an outer point. So when I pull on it, boom, it moves away. I pull on it, it moves away. So when it moves away, the thigh is moving away from the midline. This is what we call abduction of the thigh. Abduction of the thigh. So again, what is the action of the gluteus medius? It allows the abduction of the thigh at the hip joint. Questions? Moving on to another group of muscles. Those are the adductor muscle group. So from their name, they are mainly performing adduction. Those are my gracilis, adductor magnus, adductor longus, and pectineus. So again, gracilis muscle, adductor magnus, adductor longus, and pectineus. On this diagram on here, first muscle from inside, it's my gracilis. Next, I see only a small part of it. It's the adductor magnus. Next is going to be adductor longus. And finally is my pectineus. So an easy way to remember which one is which is something to help you memorize the names and to not get confused. Remember, between the thighs, you have a gap, G-A-A-P. So you start here, gracilis, next adductor magnus, next adductor longus, next pectineus. All right, so what's the first muscle on here? It's my what's the first muscle on here? Again, what do we call the first muscle? It's my gracilis. Next, it's my adductor magnus. Somebody would say, how come is this a magnus? It is supposed to be large muscle. It's magnus. So how come you're pointing out to this tiny small muscle? Because you see on here, you can see only a small part of it from this view. But if we're looking here, all this is my adductor magnus. It's a huge muscle, but it is just covered by other muscles. But it's huge. This is my adductor magnus. What's next? Adductor longus, and finally pectineus. So what is the main action for all this group of muscles? To perform adductions. That's why we call them the adductor muscle group. So all of the four muscles gonna be pulling the femur because they are all inserted in the femur. So they pull the thigh towards the midline. This is the thigh on here. It pulls it towards the midline. So we call this as adduction of the thigh at the hip. I'm performing adduction of the thigh at the hip joint by adductor gracilis, adductor magnus, adductor longus, and pectineus. The only ones that can perform some of the muscles on here, like the pectineus and the adductor longus, as you see, they are passing in front of the hip joint. So if I'm passing in front of the hip joint, when I contract, what action am I aiding here? If this is my origin, this is my insertion. So I'm pulling the thigh towards the pubic bone. So it's gonna be moving towards the midline. This is one movement, adduction, but also might be moving in this direction, right? So if I'm pulling the thigh upwards towards my pelvis, this means it aids in the flexion of the hip joint. So again, what is the main action performed by all of the four of them? They are all performing adduction of the thigh at the hip joint. Gracilis and adductor longus, as you see on here, they are passing in front of the hip joint. So when they contract, they will be aiding in the flexion of the hip. Moving on to the group of muscles located in the anterior aspect of the thigh that will allow the movement of the leg. Looking on here, I have a muscle with four heads. We call this muscle is my quadriceps femoris. So this is 1, 2, 3, and we've got the fourth one deeper to this here. This is the fourth muscle. So what do we call again all the four of them together? It's my quadriceps femoris. And as you see, the quadriceps femoris will be surrounding the patella, the kneecap, by its tendon. And as a continuation of the tendon of the quadriceps femoris, we're going to see the patellar ligament coming down from the patella to be inserted, as you see on here, in the tibial tuberosity of the tibia. All right, so again, what we're looking at in here, it's my quadriceps femoris. Quadriceps has four muscles that will be inserted by a single tendon that surrounds the patella and keeps going down as the patellar ligament to be inserted in the tibial tuberosity. The first muscle here, the large long muscle that is traveling straight in the thigh, is what we call the rectus femoris. Why do we call it rectus femoris? Because it's traveling straight down and it's located in the thigh. So we call this muscle again, it's my rectus femoris. Rectus femoris. We have a large muscle that is located in the outside, away from the midline. We call this muscle, it's my vastus lateralis. A vast, large, big. So the large muscle of the thigh located on the outside, away from the midline, this is my vastus lateralis. And the one that is located here towards the midline, towards the inside of the thigh. So we call this is my vastus medialis. Vastus medialis. The one located deeper to the rectus femoris, it's a large muscle as well, but it's located between, as you see on here, between the vastus lateralis and the vastus medialis. So we call this one, it's my vastus intermedius. Vastus intermedius. All right, vastus intermedius. So what do you think is going to be the action here of the quadriceps muscle? So what do you think is going to be the action of all those four muscles when they contract? So you see on here, I'm getting my origin from the femur, and I'm inserted in the tibial tuberosity of my tibia. On here, this is my origin, and this is my insertion. So what do you think is going to be the action here? So again, what is the name of the muscle? The four muscles all together, they are called quadriceps femoris. This one on here, it's the rectus femoris. Outside, vastus lateralis, inside vastus medialis. So you see on here, deeper to the rectus femoris, we have another muscle. This is called the vastus intermedius, which is this one. Is this clear? All right, so those are two muscles on top of one another. Rectus femoris and vastus intermedius. Yes, so one is superficial, the other one is deeper. So when I make this one, the rectus femoris fade, you can see the vastus intermedius underneath it. But here on this side, it has been removed. Rectus femoris has been removed. All right, so what do you think? If this is my femur on here, greater trochanter, head, neck, this is my tibia, and I'm telling you that 3 of the 4 muscles are going to be getting their origin directly from the femur to be inserted down here in my tibial tuberosity. So this is my insertion, this is my origin, and this will be my insertion. So what do you think is going to be the action when I pull the tibial tuberosity towards my femur? See on here, this is the thigh, and this is the knee. And this is my leg on here, foot. All right, so this is a point of origin of the muscle. And this is a point of insertion of the muscle. So what do you think is going to be the action of this muscle when it pulls this insertion towards the origin of the muscle? So we're looking at the knee joint, and we're moving along the sagittal plane. So where is the angle of the knee joint? Is it in the back or in the front? Do you remember back from the joints chapter? The angle of the joint Here for the knee, it's located posteriorly. So this is the angle of the joint. So when I pull the leg to move forward like this, what happened to the angle of this joint? Did it increase or decrease? So all this is the angle now. All this is my angle now. So what happens to the angle of the joint? Did it increase or decrease? Increase the angle. And what do we call the movement in which we're going to have an increase in the angle of the joint along sagittal? You remember, what do we call it? Extension. So we call this as extension of the knee. All right. So all of them going to be performing extension of the knee. Rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, all of them. But you see on here, the rectus femoris, it's getting its origin from the iliac bone. See? I'm getting my origin from the iliac bone. So the rectus femoris is not only traveling in front of the knee joint, it's also traveling in front of the hip joint. So what do you think is going to be the action of a muscle that travels in front of the hip joint as you contract this muscle? What do you think? So a muscle in here that gets its origin from the iliac bone and goes down to be inserted in the tibial tuberosity. So I will be pulling the leg as well as the thigh with it towards my origin. So what action am I performing in this case? What is the action? Remember, this was the angle. When I pull the thigh, forward like this, I will be reducing the angle of the joint. So it's going to be performing flexion of the hip. Flexion of the hip. All right. So again, the muscles that we're looking at right now, it's a muscle formed of 4 heads or 4 muscles that get inserted all together by a single tendon in the patella, and as a continuation of the tendon we get the patellar ligament that gets inserted in the tibial tuberosity. We call this muscle, it's my quadriceps femoris. Remember, 4 muscles forming the quadriceps femoris, a large muscle on the outside away from the midline, vastus lateralis, one on the inside of the thigh towards the midline. This is my vastus medialis, and one is located deeper to this muscle. It's my vastus intermedius. A long straight muscle of the thigh that covers the vastus intermedius. It's my rectus femoris. All of the 3 vasti are getting their origin from the femur and will be inserted in the patella and then to the tibial tuberosity. So all of them are performing extension of the knee joint. The rectus femoris is getting its origin from the iliac bone. So it's going to be traveling in front of the hip joint, and it joins the rest of the quadriceps femoris to be inserted in the tibial tuberosity. So it's also going to be passing in front of the knee. So rectus femoris is traveling in front of the hip, in front of the knee joints. So what action would I be performing passing in front of the hip joint? I am performing flexion of the hip. And what action would I be performing passing in front of the knee joint? I would be performing extension of the knee joint. So you see on here, rectus femoris is passing in front of the hip, in front of the knee. It performs, as a result, flexion of the hip joint and extension of the knee joint. Right? Any questions? So the three vasti you see on here, they get their origin from the femur, not from the ischium. See on here. This is the ischium on here. And those are the vasti. 1, 2, 3. So this is the ischium. I'm not getting my origin from the ischium. The vasti, the three vasti, lateralis, medialis, and intermedius are getting their origin, as you see on here, from the femur. All right. But the rectus femoris is getting its origin from the iliac bone. See, this is my iliac bone. And this is going to be the origin for the rectus femoris. Any questions? Any questions? All right, so we can have a 10 minutes break. We come back, discuss more about the muscles of the lower limb.